At the Southwest Veterinary Surgical Service, we're commonly presented with trauma cases, and a lot of these trauma cases will have a fracture. When someone brings their pet into us, we want to be real careful that we assess the entire patient, because there could be other trauma besides the obvious fracture that we have to deal with, that we want to make sure that we evaluate the patient as a whole to rule out other problems. If we don't find any other problems, we'd want to make sure we'll take x-rays to assess what kind of fracture he has and the best method to correct it or stabilize this fracture so it can give him his best chance to heal properly. There's several things we look at when we decide what type of fixation we're going to apply to this fracture. Is it a simple transverse fracture? Do we have an oblique fracture that's split across the bone? Or is the bone broken in several pieces where we may need more stable types of fixation? And here at SVSS, we have the advantages of having multiple ways to repair fractures. One thing being a surgeon, we have access to a lot more modalities to stabilize a fracture. It could be something as simple as a pin and cerclage wire type technique, or we could put a plate, a bone plate, to help stabilize a fracture. Sometimes we have to add things with the plate, like an IM pin if it's a severely comminuted fracture. In some fractures, if the animal is very young, the fracture is going to be fairly stable, the patient is not too active, we can use a splint or a cast as a modality to stabilize this fracture.